I'm Dr. Yeshita Pujar. I'm a professor and head Department of Obstetrics and Gynaecology at JN Medical College and KLE Hospital, Belgavi. Today, on the occasion of International Women's Day, I would like to talk about prevention of cancer cervix, as this cancer is a preventable and treatable cancer. In India, cancer cervix is the second most common cause of cancer in females following breast cancer. Every year in India, still about 1 to 1.2 lakhs of women are diagnosed as fresh cases of cancer cervix, and out of them, there is a high mortality of around 75 to 80,000 women, despite of the fact that this is a preventable and treatable cancer. Now, this cancer cervix, why does it occur? It mainly occurs because of an infection called as an HPV infection. HPV is a human papillomavirus infection, which is a sexually transmitted disease which can affect the skin, the genital area and the lungs. Every woman at some point of time in her life is infected with the human papillomavirus. It is usually present without any symptoms. When this HPV virus stays for a long time, it can result in development of abnormal cells, which over a period of time, it takes about 10 to 15 years for it to develop into cervical cancer. There are certain high-risk types of HPV virus which causes the cervical cancer. So mainly there are 4 subtypes, that is HPV 16, 18. So this HPV infection can be prevented in females. So this can be done by HPV vaccination in young girls between 9 to 14 years. This is done by, we have 2 vaccines which are available. We have the quadrivalent vaccine, which is called as the Cervavac, protective against 4 strains, that is HPV 16, 18, which costs only about 2,000 rupees. And the other one is Gardasil 9, which prevents about 9 strains of the HPV virus. This vaccination can be extended even up to 26 years who are not sexually active. It can also be offered to sexually active women even up to the age of 46 years. It doesn't cause any harm. Only thing is it can reduce the efficacy of the vaccine. And thirdly, maintenance of menstrual hygiene. Now coming secondarily, just like every woman does a self-breast examination, we must promote cervical cancer screening in women beyond 30 years of age. So every woman must just get a pap smear or something called as VIA, which is visual inspection with acetic acid, beyond the age of 30 years. Every 3 years they have to get a pap smear done, and every 5 years they need to get tested for HPV virus. So by doing this simple test, we can prevent cancer, because these screening tests diagnose cancer at a precancerous, that is, before the cancer develops. There are certain changes which are taking place in the cervix which can be detected, and the patients can be completely treated and prevented from getting cervical cancer. And finally, the third thing is, women must be aware of the symptoms of cancer cervix. So what are the symptoms of cancer cervix? Once a woman attains menopause, she should not have any kind of bleeding. So postmenopausal bleeding, bleeding following coitus, that is bleeding following sexual intercourse, any irregular bleeding, any bleeding in between menses, foul smelling vaginal discharge and weight loss. These are the symptoms of cancer cervix. In India, why there is such a high incidence of death occurring from cervical cancer is because women are presenting in the late stages of cancer to us. So, by promoting HPV vaccination, by screening herself every 3 yearly with pap smear from the age of 30 years up to 65 years, and consultation with the gynecologist when she has abnormal menstrual symptoms will go a long way in preventing death from cervical cancer. So on this International Women's Day, we at KLE Hospital are vaccinating all the female postgraduates of all the clinical and the non-clinical departments, trying to take a step ahead in prevention of cervical cancer.